Good afternoon. Welcome to the daily briefing at St. Clair County EMA, where we're bringing you the latest information and numbers from our dear friend Sam Bierman, and Chairman Kern will be here with us. And Sam, more numbers, more numbers.
More numbers and more numbers. And today, kind of like yesterday, not one of our best days, but I think we will be able to recover from this. So as of today, 6,823 tests have been performed in St. Clair County with 1,198 positive test results, which is an increase of 31 from yesterday. And that does include both males and females from their teens up to their 80s. We are at 5,560 negative test results and 65 test results that are still pending. We do have some new deaths to add to our total today, which brings our total to 94. So that's 2 new additional deaths, a female in her 60s and a female in her 90s, who both did have underlying health conditions. And as always, our condolences go out to their families. For those residents who have completed their IDPH required 14-day quarantine period, we are at 756. And for the state, we are at 851,762 that have been tested, with 117,455 positive test results, which is an increase of 1,622 from yesterday. And for the state, we are reporting 5,270 deaths, which is an increase of 86 from yesterday. For our hospitalization numbers, and these are for hospitals that are in St. Clair County, we currently have 53 people that are hospitalized due to COVID-related reasons, and 6 of those patients are on ventilators. For congregate living facilities that are in outbreak status, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, Brea of Belleville has 24 cases and 3 deaths. Brea of Cahokia has 8 cases and no deaths. Caritas Family Solutions in Belleville has 11 cases and no deaths. Caseyville Nursing and Rehab has 3 cases and no deaths. Cedarhurst of Shiloh has 11 cases and no deaths. Cedar Ridge of Lebanon has 4 cases and no deaths. Colonnade Senior Living in O'Fallon has 4 cases and no deaths. Four Fountains in Belleville has 104 cases and 23 deaths. Help at Home in Belleville has 2 cases and no deaths. Help at Home in O'Fallon has 5 cases and no deaths. Knollwood Retirement Center in Caseyville has 8 cases and 1 death. Lebanon Care Center in Lebanon currently has 53 cases and 10 deaths. Memorial Care Center in Belleville has 43 cases and 5 deaths. New Athens Home for the Aged has 39 cases and 3 deaths. St. Paul's Home in Belleville has 40 cases and 11 deaths. Swansea Rehab and Care Center has 11 cases and no deaths. And TDL Incorporated in Belleville has 4 cases and no deaths. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. So today is a day that we've talked about for a long time. It's moving into phase 3 of the recovery phase of the Restore Illinois program. We had a request from a person who watches us on a regular basis to basically go over what is opening today, what the changes are. Remember, there are always changes. This is kind of an ongoing process, so there is guidance out there on the Illinois Department of Public Health website on churches and religious services, so you need to take a look. It's quite a lengthy document. It really makes a lot of recommendations so that people can worship, but they're making recommendations to do it in a safe way. We have heard about a church in Southern Illinois that opened up too early, didn't follow those requirements, and saw the infection rate rise in their congregation. And certainly, Illinois Department of Public Health wants to try to stop that. So, what is opening on phase 3? Manufacturing, and that's non-essential manufacturing that can safely operate with social distancing, is allowed to open, and all of these are to use IDPH guidance that's provided. All non-essential businesses are now opening, and they're of course going to follow the approved safety guidance and give accommodations for their COVID-19 vulnerable employees. Bars and restaurants are open for delivery, pickup, and drive-through, as well as today you're going to see outdoor activity with both bars and restaurants. Personal care services and health clubs Barbershops and salons are open, and they opened this morning. Health and fitness clubs can provide outdoor classes and one-on-one personal training with IDPH-approved safety guidance. And then all retail is open with capacity limits, and those are generated by the Illinois Department of Public Health along with safety guidance. And of course, on all these activities, when possible, always try to include face coverings. That's extremely important to keep the spread of COVID as low as possible. Sam, we looked at the numbers today. We continue to have numbers that are higher than what we would like. Herb received a call from hospital this morning saying that they're seeing a bit of a spike, and everybody's out there wanting to know why that's occurring and how we can make sure that we don't see that. So let's all stick together, wash our hands, social distance, wear masks. This is going to be a beautiful weekend. It's a beautiful day today, going to be a beautiful day tomorrow. The temptations are there. Let's not let down our guard, because letting down our guard means that perhaps we won't be able to move into phase 4 as rapidly as we want to. Let's keep our numbers low. St. Clair County, let's lead. Let's show how things are meant to be done. With the zip code report today, remember, if you don't hear your zip code, doesn't mean that you don't have any COVID positive people in your zip code. It just means that you haven't risen to the level above 5 yet. In 62059, we remain the same at 7. In 62201, we remain the same at 16. 62203, we're now at 41. That's an increase of 3. 62204, we remain at 45. 62205, we're now at 45, and that's an increase of 1. 62206, we're now at 102. That's an increase of 5. 62207, we remain static at 68. 62208, we're now at 72. That's an increase of 3. 62220, we're now at 138. That's an increase of 7. 62221, we increased by 5 today to 106. 62223 remained the same at 48. 62226 is now 131. That's an increase of 3. 62232 increased by 2 to 21. 62239 remained the same at 13. 62243 remained the same at 8. 62254 increased by 4 to 32. 62257 increased by 1 to 11. 62258 increased by 1 to 17. 62260 remained the same at 7. 62264 is now 39. That's an increase of 1. 62269 is now 70. That's an increase of 1. And 62285 is now at 12, and that's also an increase of 1. Herb?
Well, Chairman, as you read those zip codes, there's 22 zip codes throughout the county that has cases in them. And it just amazes me how there are still some people out there, not many, but there are still some out there that want to talk about how this is nothing, it's the flu, and it's everybody gets it. But, we've got 22 zip codes in the county that has got cases in it. So, and as I tell people when I get private messages or people call the EOC, everybody has said, the physicians that's been on here said, no, this is worse than the flu. There is treatment for flu. There is no treatment for the COVID-19. So those of you that continue to take it serious, we appreciate that. For those of you that don't, that's your decision.
And those are just the cases that we know about.
Just that we know about.
And from what we hear all the time, and people hear it on the various news sites and through medical briefings, that there are many, many, many more that are out there that aren't diagnosed, that don't have symptoms, people that don't know they have it. This is big.
Well, and we have several followers, as you know, that follow our briefings. And Sam, you've been here, and all of those physicians and those medical experts that we've had on here, and they come from the different hospitals, different walks of life, basically. Even the nurses, the paramedics that we've had on, they've all said the same thing. There's a discussion that always goes on, no, we don't need to wear a mask because so-and-so said that we didn't have to. It causes more problems. Well, we haven't had one of those experts on here that has said a mask is a safety precaution.
Exactly. And we've said this before, no one is more anxious for life to get back to normal than we are. And I mean, if we could hit the fast forward button on this, we certainly would. But to get back to, what we're going to call normal or our new normal, we need to keep doing these preventative measures that we can do to help slow the spread of this.
Well, and I just saw something, and we received a couple of calls today in the OC that even Missouri was supposed to move into their next phase, but they've now backed that to the middle of June. And of course they said, the governor said, well, it wasn't because of what took place in the Ozarks, but who knows? All we know is that it's going to be 2 more weeks into June before they move into their next phase over there. So that tells me that the states around us are still keeping an eye on it, just like we're doing here in the state of Illinois. And then, as we've said many, many times, the governor gets all the flack because he is the governor, but he's got a task force from day one. He's got the medical experts, the scientists, and he said it again today on his briefing. This thing has been led by the scientists. That's what you've done here, Chairman. You've had your group of people that has followed it. And that first Sunday that we went over to Missouri, you said then, we're going to let the medical experts follow this, and we've done that day after day.
And there's a difference. So saying, well, now we're not going to move ahead and extend things, that's really reacting to what happened in the Ozarks. In this state, we're trying to be proactive. So we're laying out a set of guidance that people can follow, and these guidelines then lead to the next phase. And that's where we are right now. We're moving now into phase 3. We are in phase 3, moving into phase 4. And if we do all the things that science says will get us to phase 4, then by the end of the month, and hopefully maybe even a little sooner if the numbers look that way, we can move into the next phase. But things have to be done in an orderly fashion and with doctors' recommendations.
Sure, and you said that earlier. I got a call from one of the hospital officials, asking about the spike over the last several days. And as I told him, we're watching it just the same as they are. And that's what I want to talk about. Today is phase 3. I drove through downtown when I was coming in this morning, and they're setting up, getting ready for the restaurants. And I want to give a shout out to, I saw a lot of posts on social media today from restaurants saying, hey, these are the guidelines that we're going to have in place. If you're going to come, we want you to, but these are what you're going to have to do. So I applaud all of our businesses that are taking that proactive step, and because they know it's important for their customers' public safety, and we applaud them for that.
And they want people to come.
Sure.
But they're saying once you're done with your meal, or once you're done, then let someone else come in and have a chance. It can't be a huge crowd. It is an Oktoberfest.
No.
Or Deutschfest, whatever happens this time of year. This really is for these restaurants to be able to serve and have their servers make some money, but yet the big crowds really aren't warranted yet.
No, and we hope that people support them. Because they're going through a lot of extra work in order to get this done. And Sam, I'm sure the health department has been overloaded with calls on the do's and the don'ts.
Yeah, I could. My office isn't far from where environmental health is, and they field a lot of those phone calls because they're the ones that do restaurant inspections and such. And the phones were ringing off the hook today with every imaginable situation that you could think of. So they've done a great job with fielding all of the calls from local venues that want to make sure that they're doing it correct.
Well, on the calls that we got here, I was really surprised. Shouldn't have been surprised, but the business owners were, we want to make sure we're doing it the right way. Mm-hmm. So to me, that just shows they're concerned about their customers, and they're excited just as we are. I mean, you said that earlier. There's nobody more excited than what we've been doing here at the EMA and the health department and the county, the leaders there. So it's been good. Today we received a big shipment of PPEs. You saw the big trailer out there. So we got an extra load in. So we'll be getting them all organized and getting ready to send out another shipment early next week. We appreciate each and every one of you who are a part of Team St. Clair. You that get on there every day and watch these briefings and leave your comments. For those of you who don't want to be a part of that Team St. Clair and you want to argue with the other people, again, that's your right. We all have our rights to do that. We just ask that you be respectful. But Team St. Clair will be here bringing the up-to-date information until the chairman says that we don't have to do these. and I can't wait for that day to come. We'll see you here tomorrow afternoon at 3:30 for the next briefing, and we'll be back with Cindy and Daisy to translate this into our Spanish communities. Have a good evening and be safe. Thank you.